Welcome to Indian Healthcare BPO channel. Indian Healthcare BPO providing training for medical coding, medical billing, clinical research, and pharmacovigilance. For further detail, contact the given number. In this video, I'm going to talk about the thyroid gland physiology. Thyroid gland is one of the largest of endocrine gland. The thyroid gland secretes two major hormones. One is thyroxine and another one is triiodothyronine, also commonly called as T4 and T3 respectively. The thyroid secretion is controlled primarily by thyroid stimulating hormones TSH secreted by anterior pituitary gland. Both of these hormones profoundly increase the metabolic rate of the body. Talking about the synthesis and secretion of thyroid hormones, about 93% of metabolically active hormones secreted by thyroid gland are thyroxine and 7% is triiodothyronine. Almost all the thyroxine is eventually converted to triiodothyronine in the tissues. So both are functionally important. Triiodothyronine is about 4 times as potent as thyroxine, but triiodothyronine is present in the blood smaller amount and it persists for a much shorter time compared to thyroxine. Talking about the physiological anatomy of thyroid gland is composed of large number of closed follicles, which is filled with a secretory substance called colloid, and it's lined by the cuboidal epithelial cells that secretes into the interior of the follicle. The major constituent of colloid is large glycoprotein called thyroglobulin, which contains the thyroid hormones. The thyroid gland also contains C cells that secrete calcitonin, a hormone that contributes to regulation of plasma calcium concentration. Then iodine. Iodine is required for formation of thyroxine. To form normal quantity of thyroxine, about 50 mg of injected iodine in the form of iodide are required each year. Fate of ingested iodides. Iodides ingested orally are absorbed from the gastrointestinal tract into the blood. Normally, most iodine are rapidly excreted by kidney. Only one-fifth are selectively removed from circulating blood by the cells of thyroid gland and used for synthesis of thyroid hormones. And formation and secretion of thyroglobulin by the thyroid cells. The thyroid cells are typically protein secreting glandular cells. Thyroglobulin, a large glycoprotein molecule, is synthesized by endoplasmic reticulum, Golgi apparatus, and secreted into the follicles. Each molecule of thyroglobulin contains about 70 tyrosine amino acids, and they are major substrate that combine with iodine to form thyroid hormones. Thus, the thyroid hormone form within the thyroglobulin molecule. Steps in synthesis of thyroid hormones: iodide trapping, oxidation of iodide ions, organification of thyroglobulins, coupling of iodotyrosine residue, and release of T3 and T4 into the blood. First, we'll talk about the iodide trapping. The first stage in formation of thyroid hormone is transport of iodides from blood into the thyroid glandular cells and follicles. This is achieved by the action of sodium and iodide sympota, which co-transport one iodide along with two sodium ions across the basolateral membrane into the cell. The energy of transporting iodide against the concentration gradient comes from sodium potassium ATPase pump, which pump sodium out of the cell to maintain low intracellular concentration. This process of concentration of iodide into the cell is called iodide trapping. The rate of iodide trapping is influenced by the concentration of TSH. A protein called penidrin, a chloride and iodide cotransporter help transport iodide out of the thyroid cells into the follicles. Then oxidation of iodide ions. The first essential step in formation of thyroid hormone is conversion of iodide ions to an oxidized form of iodine, which is then capable of combining directly with the amino acid tyrosine. The oxidation of iodide is promoted by the enzyme called peroxidase and accompanying hydrogen peroxidase located in the apical membrane of the cells. When peroxidase system is blocked or when hereditary absent from the cells, the rate of formation of thyroid hormones falls to zero. This is the reaction of the iodide oxidation. Iodination of tyrosine and formation of thyroid hormones called organification of thyroglobulins. The binding of iodine with thyroglobulin molecule is called organification of thyroglobulin. In thyroid cells, the oxidized iodine with the help of thyroid peroxidase enzyme cause the process to occur within a second or a minute. Tyrosine is first iodized to monoiodotyrosine or and then diiodotyrosine. The final formation of two important thyroid hormones, thyroxine and triiodothyronine, occurs here. Then another step, which is coupling of iodotyrosine residue. Immediately after the formation of monoiodotyrosine and diiodotyrosine residues become coupled with one another. The major hormonal product of coupling reaction is the molecule of thyroxine T4, which is formed when two molecules of diiodotyrosine residues are joined together, or one molecule of monoiodotyrosine coupled with one molecule of diiodotyrosine to form triiodothyronine, which is T4. A small amount of reverse T3 are formed by coupling of diiodotyrosine with monoiodotyrosine, but reverse T3 does not appear to be functionally significant in humans. What about the storage of thyroglobulins? After the synthesis of thyroid hormones, each thyroglobulin molecule contains 30 thyroxine, which is T4, and few triiodothyronine, which is T3. In this form of thyroid hormones are stored in the follicles is an amount sufficient to supply the body with its normal requirement of the thyroid hormones for 2 to 3 months. Therefore, when synthesis of thyroid hormone ceases, the physiological effect of deficiency are not observed for several months. Then, the release of thyroxine and triiodothyronine. Most of the thyroglobulin is not released into the circulating blood. Thyroxine and triiodothyronine are cleaved from the thyroglobulin molecule and then released as a free hormone. About 3 of the iodinated tyrosine in the thyroglobulin never become thyroid hormones but remain as a monoiodotyrosine and diiodotyrosine, and the iodine is cleaved from them by deiodinase enzyme that makes virtually all the iodine available again for recycling within the gland. Transport of thyroxine and triiodothyronine to tissue. Generally, T3 and T4 are bound to the plasma protein, which is synthesized by the liver. They mainly combine with thyroxine binding globin, and T3 and T4 are released slowly into the tissue cells. And thyroid hormones have slow onset and longer duration. Talking about the thyroid hormone interaction with receptor, the general effect of thyroid hormone is to activate nuclear transcription of gene. The thyroid hormone activate nuclear receptor. The thyroid hormone receptors are either attached to DNA genetic strands. On binding with the thyroid hormones, the receptor become activated and initiate transcription process. And then large number of mRNA are formed, followed within a few minutes or hour by RNA translation on the cytoplasmic ribosome to form new intracellular protein which cause most of the effect of the thyroid hormones. In this slide, we'll talk about the physiological function of thyroid hormones. Metabolic function, like carbohydrate metabolism, stimulate all aspects of carbohydrate metabolism. Enhance glucose uptake, glycolysis, gluconeogenesis, and increased insulin secretion. In fat metabolism, it enhances lipid mobilization from fat tissue and increase free fatty acids, decrease cholesterol, phospholipids, and triglycerides in the blood, and increase vitamin requirement and metabolic basal metabolic rate. In general feature, like it decreases the body. Talking about the actions of specific system, like in cardiovascular system, it increases the heart rate, cardiac output, and force of contraction. In respiratory system, it increases the rate of respiration. In gastrointestinal system, it increases the motility of the GI tract, and in CNS, it increases the rapidity of cerebration. And in musculoskeletal system, it slightly increases the excitement of the musculoskeletal system. When it occurs excessive, it causes the muscle weakness. In endocrine system, the activity is increased in all glands. Then, regulation of thyroid hormones. Anterior pituitary secretion of TSH is regulated by TRH from the hypothalamus. TSH from anterior pituitary gland cause increased secretion of thyroid hormones in the thyroid gland. Feedback effect of thyroid hormones. Like increased thyroid hormones in the blood fluid decreases the TSH by directly inhibiting the anterior pituitary gland by itself. Now we'll talk about the disease of thyroid gland. First, we'll talk about the hyperthyroidism, which is caused by Graves' disease and thyroid adenoma. Graves' disease, the most common form of hyperthyroidism, is an autoimmune disease in which antibody called thyroid stimulating immunoglobulins form against the TSH receptor in the thyroid glands. So the TSI stimulate the thyroid gland to produce thyroid hormones. So increased thyroid hormone leads to hyperthyroidism. The high level of thyroid hormone cause TSI in turn suppresses the anterior pituitary formation of TSH. So there will be a increased thyroid hormones and decreased TSH. Talking about the thyroid adenoma, it's a tumor that develops in the thyroid tissue and secretes large quantity of thyroid hormones. So this increased amount of thyroid hormones inhibits the TSH from the anterior pituitary gland. Exophthalmos. The most people with hyperthyroidism exhibit the protrusion of eyeballs is called exophthalmos. This is due to edematous swelling of retroorbital tissue. What are the symptoms of hyperthyroidism? Like intolerance to eat, increased sweating, diarrhea, muscle weakness, tremors, and mild to extreme weight loss, nervousness, psychotic disorder, and extreme fatigue and inability to sleep. Now we'll talk about hypothyroidism. Hypothyroidism is opposite of hyper, and it is also often initiated by autoimmune antibody against the thyroid gland, also called hypothyroidism, and it is called as Hashimoto diseases. Endemic goiter also caused by hypothyroidism. The term goiter means greatly enlarged thyroid gland. The lack of iodine prevents the production of T3 and T4. As a result, no hormone is available to inhibit the production of TSH from the anterior pituitary, which cause the pituitary to secrete large quantity of TSH. And TSH then stimulate the thyroid cells to secrete more amount of thyroglobulin, collides to follicles and glands to grow larger and larger. Symptoms of hypothyroidism include constipation, increased body weight, slow heart rate, fatigue, extreme muscle weakness, mental weakness, and intolerance to cold, decreased sweating, and extreme sleepiness and dry skin. This is the differentiative between the hyperthyroidism and hypothyroidism. Thank you for watching the video, and for further videos, subscribe the Indian Healthcare BPO channel.